Drug abuse, or should I say substance abuse, is the misuse of chemical substances or drugs for the effect of appealing to the brain, like to give you some sensations to the brain. It can also refer to using drugs in methods or amounts that go contrary to prescription and can be harmful to individuals or people. So, yes, basically, that is drug abuse. People abuse drugs out of curiosity. They want to find out how it feels or the derivation they get from it. Take, for example, codeine. It's a regular drug. You can acquire it out of prescription, but now it has a side effect. What is the side effect? It releases you, it eases you, and also in most cases can send you to sleep. So people, or should I say the young adults in the society, abuse this particular drug by taking it in an overdose, and that's where drug abuse comes in. Now there are other reasons apart from curiosity. It could also be they're trying to solve a problem. Let's say antihistamines. Now, when I say antihistamine medications, we're talking about your Piriton, your loratadine, that helps to ease when you have flu or you have some allergy. So those are the kind of drugs you can take. Now, these are normal drugs ordinarily, like your doctor can prescribe to you when you take a prescription and go acquire it. That they're called OTC, over-the-counter drugs. Now, people abuse these drugs because it eases you and it prevents you from having those allergic reactions. They take it on overdose, thereby it sends them to sleep. So some people prefer sleeping naturally and take an overdose of antihistamines to allow them to just be drowsy and sleep. So these are just a few reasons why most people prefer to rely or abuse drugs. And then for the gratification of it, the feel, because of the dopamine that the brain produces. So when you take these drugs in an overdose, it definitely sends signals right there and gives you some kind of temporary nice feeling. So when we looked at those that are affected, we say that there is no specific age bracket. Young adults, even the aged ones. Okay, take for example, a person has a joint pain or a waist pain, and the first thing that comes to your mind is taking an analgesic, like for example, stronger, like PCM, which is paracetamol, or ibuprofen. So now you do not have a doctor's prescription. You didn't go to a hospital to ascertain what could be causing your joint pain or your waist pain or whatever pain that you're having. But because premeditated, you already know that you take paracetamol and if you have headache, it will go. And they advertise it on the news or on the television, and you see that, quickly go and get this. And funny enough, you see even we have our local shops that sell these things, and then you take this headache, I feel so terrible. You have 4 tablets. That's abuse. Okay. You cannot take 4 tablets because of the way you're feeling. That's why prescription is very important. Now we cannot say that it's only the adults that are exposed to this or that are affected, because even the aged ones also are affected. Now let's say somebody whose body is used to taking antihistamines, that's maybe loratadine or Piriton, and then it sends you to sleep. For every time you cannot sleep for an awkward way, I remember that medicine when I used to take it, I sleep, and before you know it, they take it 2 or 3 tablets and it sends them to sleep. That's abuse, because now you're not taking it as a corrective or like manage your ailment. Now you're taking it for something else, and that is drug abuse. So I will not say that it only affects 16-year-olds or teenagers. I'll say it's more like a general thing. Well, a solution can be hard, but it can be managed. Yeah. So instead of you to take ibuprofen because you have a pain, you go to a doctor so that you can ascertain what the problem is, and then he will prescribe the drugs appropriate for that ailment. Another thing is, if you have that urge, like for those who abuse some chemical substances that are drugs, when that urge comes, there are things that it's good to be around people. It's good to keep your mind busy. That can also help. And then if it gets to the point where it becomes a disorder, where you're addicted, you cannot control yourself, you cannot help yourself, especially once you started taking these hard chemicals like opium and the rest of it, then rehab is the likely.
So when you are addictive, is a disorder.
Yes.
Wow.